Hernias are very common. We treat the variety of hernias from the simple to the complex. With the robot, we're also able to do it all with small incisions, which tremendously helps with recovery of patients and getting them back to work faster. Symptoms of an abdominal hernia vary greatly, but usually involve some abdominal pain, a bulge over a prior incision, or a new hernia that has formed as a result of lifting, maybe having babies, a variety of reasons, but the treatment usually is the same.
More concerning symptoms can be nausea, vomiting, increasing abdominal pain.
Generally, hernias can occur in two different scenarios. One is an emergency hernia, where someone can get severe abdominal pain, maybe some nausea, vomiting, and they're really not feeling well. In that scenario, usually the patient will go to the ER and get treated, and they'll call the surgeon. The second scenario is where we mostly see patients is when someone comes in for an elective consultation into our clinic. We see those types of patients in routinely, evaluate them, maybe get some sort of imaging study, and then decide on surgery if that's the right course of treatment. Usually a hernia repair involves closure of the hole and placement of a mesh that can be done with open surgery, which you can imagine is a large incision, or the way we typically doing this is with a robotic repair, which has several small incisions, faster recovery, and a repair of the entire hernia, whether it be small, complex, large, chronically stuck with bowel, whatever the case may be, we can do that with a small incision in robotic surgery.
Most patients that come in for hernias are candidates for robotic surgery and minimally invasive surgery. There are a small few, for example, people who have had multiple abdominal surgeries in the past who may not be a candidate.
The surgeon will evaluate the patient in clinic. Usually we'll see the patient, we'll examine them, we'll review all the images and have a discussion, and at that time make the decision if robotic surgery is appropriate. We still know how to do the other types of surgeries, however, we prefer the robotic repair secondary to the benefits that it gives our patients.
I think it's important to go to someone who specializes in hernias, because a hernia expert has multiple ways of fixing one hernia. We can really tailor our approach and the technique to approach that hernia in various different ways and tailor that to the patient.
Many types of hernias require a technique that is somewhat difficult to master. We've been doing this for quite some time now, so we have these techniques down very well. In fact, we teach other surgeons how to do these types of techniques in surgeries. However, when you're in surgery, sometimes plan A doesn't work, so it's important to have a plan A, B, and C, as oftentimes we may have to do different types of surgery depending on what we find at the time of surgeries.
Really, the robot also offers increased visualization, increased dexterity. Previous and traditional laparoscopic instruments are basically graspers on sticks. The robot allows us to have wristed instruments, allows us to work in smaller spaces within the body cavity and the abdominal wall, and really helps limit the chances of us having to convert to a procedure.
Smaller incisions obviously better because you have less pain, there's less recovery, and there's less risk of developing complication to that hernia itself. Some of the patients that we operate on down the road might need other surgeries, so the smaller the incision, the better it is for current healing and future interventions as well. Basically, get the surgery, get it done faster, more efficiently, recover quicker. That's our ultimate goal when we take care of our patients.
Wow.
One of the other things that this has allowed is us as hernia surgeons to move the mesh out of the abdominal cavity where it's prone to infections, adhesions, small bowel obstructions, and really get it within the abdominal wall, whether that's above the peritoneum or within the retrorectus space within the muscle fibers.
As you can imagine, there's different types of hernias. Some of the simple hernias can take about an hour or so. The more complex, talking about the redo large hernias with prior surgeries, they can take up to 3 to 4 hours for an abdominal wall reconstruction. So it really depends on the type of surgery that is needed at that time.
And even with the more complex surgeries, most of our patients, 95%, are still able to go home that day. The initial consultation is non-invasive. It's the simple abdominal exam. We take a look at the hernia, Sometimes we need some imaging afterwards if it's more complex, but there's no invasive component to the initial exam.
One of the worst things you can do is ignore the hernia, because the hernia will not go away, and there are severe problems that can happen with a hernia. A piece of bowel can get stuck in it, hernia can increase in size, and each one of those components and worsening symptoms can cause problems down the road. So please visit us as soon as you can to get this hernia evaluated and treated.
To make an appointment with myself, Dr. Blea, or Dr. Leva, call 505-727-2727 or visit Lovelace.com.